Hello everyone, and welcome back to our channel where we break down complex medical topics into understandable, actionable health advice. I'm Dr. Kelvin, and today we're going to talk about a subject that many find uncomfortable to discuss, but one that is absolutely crucial for your health and well-being: the medical risks associated with anal sex. Anal sex, understanding the medical risks. Now, before we dive in, let me be very clear. This conversation is not about judgment, shame, or telling anyone what they should or shouldn't do in their private lives. My role as a doctor and health educator is to provide you with accurate, evidence-based information so you can make informed decisions about your sexual health. Sexual health is a vital component of overall health, and understanding the risks associated with any sexual activity is paramount. Let's start with a sobering statistic, one that highlights the urgency of this discussion. Did you know that receptive anal sex carries the highest risk of HIV transmission per act compared to any other sexual activity? Yes, you heard that correctly. According to the CDC and numerous peer-reviewed studies published in journals like The Lancet and JAMA, the risk of acquiring HIV during receptive anal intercourse is significantly higher than during vaginal sex or oral sex. This isn't a minor difference. It's a difference that can profoundly impact your life. Why is this the case? It primarily comes down to the anatomy and physiology of the rectum. Unlike the vagina, the lining of the rectum is much thinner and more delicate. It's not designed for the friction and stretching that sexual activity can entail. This delicate lining also has a rich blood supply, and when tiny tears or microabrasions occur during anal sex, and they often do, even imperceptibly, they create direct pathways for viruses like HIV to enter the bloodstream. Furthermore, the rectum is rich in immune cells that HIV specifically targets, making it an ideal environment for the virus to take hold. But HIV is just one piece of the puzzle. The spectrum of sexually transmitted infections, or STIs, transmitted through anal sex is broad and concerning. Let's talk about them. Increased risk of STIs. HPV, or human papillomavirus. This is incredibly common. Many people don't even know they have it. While some strains cause warts, others can lead to cancer. The CDC estimates that nearly all sexually active men and women will get at least one type of HPV at some point in their lives. Anal sex significantly increases the risk of anal HPV infection, which, like cervical HPV, can progress to anal cancer. The American Cancer Society, for instance, provides extensive data on the rising incidence of anal cancer, strongly linked to persistent HPV infection, particularly in individuals who engage in anal sex. Then we have the bacterial infections: gonorrhea, chlamydia, and syphilis. These can all infect the rectum and anus, often without obvious symptoms. Someone might have a rectal chlamydia infection and not know it, continuing to transmit it to partners. Untreated, these infections can lead to serious health issues, including pelvic inflammatory disease in women if they spread, and long-term damage to the rectum itself. The World Health Organization, or WHO, consistently highlights the global burden of these STIs and the importance of screening, especially for those engaging in anal sex. And let's not forget herpes simplex virus, or HSV. While often associated with oral or genital lesions, herpes can also manifest around the anus, causing painful sores. Transmission can occur even when no visible sores are present. Now, beyond STIs, there's another crucial category of risks: physical trauma. The anus and rectum are not designed for penetrative sex. They're designed for defecation. This fundamental difference makes them susceptible to injury. Physical trauma risks. We're talking about conditions like anal fissures. These are small tears in the delicate lining of the anus. They can be incredibly painful, causing bleeding and discomfort during bowel movements, and can sometimes become chronic. Imagine trying to heal a wound that gets stretched and irritated several times a day. Hemorrhoids, while not exclusively caused by anal sex, the increased pressure and trauma can exacerbate existing hemorrhoids or contribute to their development. These are swollen veins in the anus and lower rectum, which can be itchy, painful, and bleed. Rectal prolapse, in some rare but severe cases, particularly with chronic strain or repeated trauma, the rectum can actually protrude outside the body. This is a serious medical condition requiring surgical intervention. Incontinence. This is perhaps one of the most feared long-term complications. The anal sphincter muscles are responsible for controlling bowel movements. Repeated trauma, particularly if severe, can damage these muscles or the nerves that control them, leading to fecal incontinence, the involuntary leakage of stool or gas. This can have a devastating impact on a person's quality of life, mental health, and social interactions. I remember a patient, let's call her Sarah, who came to me with chronic anal pain and occasional leakage. She was in her late 20s and had been engaging in anal sex for several years without using adequate lubrication or being aware of the potential for injury. Her symptoms had progressed to the point where she was embarrassed to go out, fearing an accident. We worked through various treatments, and while she improved significantly, it was a long and difficult journey that could have been avoided with better awareness and practices. This is a real story, illustrating the real consequences. Moving on to long-term complications. These are not just about immediate pain or infection. They can have a lasting impact on your health. We've already touched on anal cancer in relation to HPV. This is a serious and potentially fatal disease. While relatively rare compared to other cancers, its incidence is rising, and the link to anal HPV, often transmitted through anal sex, is undeniable. Regular screening, especially for those at higher risk, becomes crucial. This is similar to how we screen for cervical cancer. Regular Pap tests have dramatically reduced cervical cancer rates. The same vigilance is needed for anal health. Another long-term issue can be chronic pain. If fissures don't heal properly, or if nerve damage occurs, individuals can experience persistent anal pain, discomfort, and even pain during sex or bowel movements, severely impacting their quality of life. This isn't just a physical burden. It often leads to significant psychological distress, anxiety, and depression. So what can you do? This information isn't meant to scare you, but to empower you. Risk reduction and prevention. Firstly, safe sex practices are paramount. Condoms, and plenty of them. Using a new condom for every act of anal sex is non-negotiable for STI prevention. Ensure it's the right size and put on correctly. Generous lubrication. This is absolutely critical. Water-based or silicone-based lubricants reduce friction and minimize the risk of micro tears. Hygiene. Proper cleaning before and after can help reduce the risk of infection. Communication. Talk openly and honestly with your partners about sexual health, STI status, and boundaries. Regular STI testing. If you engage in anal sex, regular STI testing that includes anal swabs for gonorrhea and chlamydia is essential. Don't assume a standard urine or blood test covers everything. Discuss this specifically with your doctor. The American College of Obstetricians and Gynecologists and the CDC strongly recommend comprehensive STI screening based on sexual practices. Optimally, HPV vaccination, if you're within the recommended age range, the HPV vaccine, Gardasil 9, is highly effective at preventing the types of HPV that cause most anal cancers and warts. This is a game changer in cancer prevention. Remember, your body is incredibly resilient, but it also has its limits. Respecting its anatomy and understanding the risks are crucial for long-term health. Don't rely on myths or misinformation. Get your information from credible sources, your doctor, the CDC, WHO, Mayo Clinic, ACOG. These organizations spend countless hours researching and validating the information they provide. In summary, while anal sex can be a part of a healthy sexual life for many, it comes with significant and well-documented medical risks, particularly concerning STI transmission, physical trauma, and long-term complications like anal cancer and incontinence. Understanding these risks isn't about shaming, it's about empowering you to make choices that protect your health and well-being. Thank you for joining me today. I know this was a sensitive topic, but one that absolutely needed to be addressed with medical accuracy and empathy. If you found this information helpful, please give this video a thumbs up, share it with someone who might benefit, and subscribe to our channel for more evidence-based health discussions. Leave your questions and comments below. I'm always happy to engage and clarify. Your health is your greatest asset. Take care of it.